welcome to my YouTube channel Ayurveda Basking. So today video is basically for our Samhita paper, Samhita Adhyayan 2, and here we are going to discuss our best MCQ series, and they are basically the KUHS previous year question paper along with that other university also. So surely they have a chance for coming in your exam, and along with that I have given some small concepts also, so like similar question can come from that portion also. Let's start our video, and the first question is, in which ritu taila is indicated? So actually this question is from your Sneha Adhyayan, in which they are mentioning like for Sharpi we have to take it in the Sharad ritu, and for Tela it is in a Pravrit, and Vasa Majja in a Madhavi. So right answer for this question will be the Pravrit, but in exam it can come for Sarpi or Vasa Majja, etc. So that shloka is a very important, and I think that is a must know shloka. It can come for SCQ marks question also. Next question is type of Niragni Sveda enlisted in Sveda Adhyam. So after the Sneha, Sveda Adhyam 14th chapter of Charka Sutra Sthana is there, and in that two type of Sveda are mentioned: Agni Sveda, Niragni Sveda. Agni Sveda is where we needed Agni for Svedana, and Niragni we don't need Agni. So here they ask about Niragni. So total there are 10 type of Niragni Sveda are there. You have to comment me which are those 10 type of Niragni Sveda. And Agni Sveda is basically 13 in number, and which is some like Acharya have explained elaborately. In of them most important is your Nadi Sveda and your Jentaka Sveda. So that things you must study because that can come in your exam, and other 12 also you study because they are important one. Next question is Timira comes under which Nanatmaja Vyadhi? So Timira is basically related with the Chakshu Indriya, and it is specifically the Vata Nanatmaja Vikare. So right answer will be the option A. Which among the following is not coming under Bahudosha Lakshana? So Bahudosha Lakshana is actually one big shloka is there in our text, and out of this Avipaka, Pandutva, Kandu are mentioned there, but Javra is not mentioned there. So right answer will be the option C. Santarpanajanya Roga among the following. Santarpanajanya means that disease which are due to the overnutrition. So overnutrition disease is also known as Santarpanajanya Roga, and Javra because Ama manifestation are there, so that is also due to the Santarpana. Muttar Kricha is also due to Santarpana. Parmeha Adi Roga is also due to Santarpana, and Klebya is also due to the Santarpana. So right answer will be the all of the above. Which of the following is not a treatment for the disease due to Viruddha Ahara? So Viruddha Ahara is actually mentioned by Acharya Charka in Atre Bhadra Kapyam chapter, and here at the last portion of the chapter he is explaining the very beautiful and unique concept of Ayurveda, that is Viruddha Ahara. In that Viruddha Ahara he is actually mentioning 18 type of Viruddha. You just thoroughly and very nicely study that 18 type because it is a must know point. And another important thing is this example, like what is the example of Satamya Vriddha, what is the example of Desha Viruddha. So this kind of MCQ that must or have more chance to come in your exam. Along with that treatment is mentioned in that Acharya is mentioning you can do Vamana, Virechna or Shamana, and some diseases are also mentioned that is happening due to the Viruddha Ahara. So you study that point very nicely because it is having a more chance to coming in your exam as a MCQ, SAQ or LAQ. But he didn't mention about the Vasti, so right answer will be the option D, which is not a pranayatna according to Acharya Charka. So basically Acharya Charka has mentioned pranayatna in two places, one in the Sutra Sthana and another is the Sharira Sthana. In Sutra Sthana he included Marmatram, along with that Sankho, and there is Rakta is mentioned, Chukkar Ojas, but Nabi is not mentioned. So right answer will be the option C. Which among the following is located in Hridya? So Hridya is actually your Chetana Adhishtanam. So it is having the it can accommodate Atma, Shadanga and Mana, and it's the most important your Pranayatna. So right answer will be the option D. Which among the following comes under the Pittaja type of Prameha? So as you know, Prameha is explained in the Nidana Sana of the Charak Samhita, and there are 6 type of Pittaja Prameha are there, 10 type of Kafaja Prameha are there, and 4 type of Vataja are there. And specifically we will say like Kapha are, which are 10 in number, they are specifically Sadhya, and this Pitta are Yapyam, and this four are asadhyam. So out of this, kal meha is it. And you know, there is a one like a trick you can make in patika. Generally color related are there: kal meha, neel meha, lohita meham, manjishtodaka meham, or haridra meham, like that. Color resemblance are there, and they are actually the different kind of pitta color. Al meha is basically your kafaja meha. Then majja and vasa meha both are vatika type of meha. Pitta Kapha dominant Kushta among the following. So Pitta Kapha is basically your Pondrika Kushta is there, and you know this the same thing we have already studied or Nidana. So you can done easily this kind of question. How many type of Unmada are described in Charaka Sutra Sthana? So basically there are 5 type of Unmada: Vata, Pitta, Kapha, Sannipata, along with that Agantuja. But Apasmara, only 4 type of Apasmara there is: Vata, Pitta, Kapha and Sannipata. So this is one of the important things you have to remember. Which among the following is a Yog Vahi? So out of this, people is having the Yog Vahi property, and it is basically Vrishya instead. Like generally we will say if a drug is having a Katurasa, it should be a Vrishya. It is a non-aphrodisiac. But only 2 exceptions for this rule are there, that is Shundi and your Pippali. So they are having Katurasa, Katurasa, Madhur Vipaka and Vrishya property. Next comes the Swasika Kriya is indicated in which kind of Sroto Dushti. Actually, when Acharya is mentioning the Srotas in Sroto Vimana, he has mentioned for this Prana, Udaka and Anna Vahasrota, what will be the Chikitsa Sutra. So he is explaining for Swasika Kriya can be given as a Chikitsa Sutra in Prana Vahasroto Dushti, and for Udaka Vaha is mentioned the Trishna Chikitsa. Anna Vahasrotas is Ama Chikitsa can be used. Next question is Sukham Pratishedascha Sukha Artham Vemiti is related with which Prakriti? So basically Sukham Pratibedam, we have to reduce the Sukha and Sukham Artham. So this is one of the treatment protocol we are giving for Kapha Prakriti, because Kapha is overnourished and they have over happiness. So we have to give them some stress, some chintananam, some mental activity, so that we can reduce their corpulence and reducing their Kapha. Sarva Apachara Saha is quality of which Agni? Sarva Apachara means it can digest all kind of food substance, and basically it is your Tikshna Agni, that is Pathikam predominant. Apratigatatva is the feature of which Panchamahabhuta? So Apratigatatva is unobstructability, that is predominantly the feature of Akasha Panchamahabhuta. Number of Koshtanga as per Charka is 57. Now you have to comment me number of Pratyanga mentioned by the Acharya Charka, how many? Okay, this question can come in your exam and you have to give comment section answer. In which month fetus derive more strength and complexion? In the 6th month fetus derive more strength and complexion, so that mother's complexion and strength will be decreasing, and in 6th month mother is feeling some weakness and less bala. Which among the following is the abnormal complication? So there are some color mentioned which will be the abnormal complexion, and you know Krishna, Shama, Avadatam are the 4 normal complexion that is mentioned in the Indriya Sthana first chapter of Charak Samhita, but Harita is the abnormal complexion. Right answer will be the option D. Attribute of Prasast Dhuta is described in which Adhyay? So actually this is explained in the Gomayam Churniyam Indriyam Adhyay. And you know, I can give you one bonus tip for this Indriya Sthana. You just see your chapter name, only the chapter name remember, and what is the content, like just heading. For example, Chaya and Pratichya are mentioned in this chapter, Pura Rupa are mentioned in this chapter, because if we just simply leaving our Indriya Sthana, we may like losing our 7 mark. But like this things you can say, oh this chapter this content in there, so if something is come from this chapter 5 marks or MCQ, you can give somewhat answer to that question. Next question is Uttama Matra of Sneha is indicated in. So Uttama Matra is the maximum Matra of a Sneha, and that is given is basically for those person who have a very good strength, who have a Krura Koshta, and who can bear all the Vyayam Atapasaha, and that is maximum Matra we can give, and it is digestion in 24 hours. So it is given in Unmada, Gulma, Sarpadamshta. Along with that it is given is Mutra Krisha, Gada Varchasam, Visarpam Uphatam, Shut Pipasa Saha. Then Vyatita Indriyam is due to, so Vyatita Indriyam is basically you are giving pain to your Indriya, and that is due to the Ojoshaya. And Ojas is one of the important concept. It can come for 5 marks question, so you must study the shloka. I have mentioned the shloka number here, and this is one of the important things that is mentioned. Sarpi Varnam Madhurasam Laja Ganti. Ojas is having the Sarpi Varnam, Madhurasam and Laja Ganti. Timiram is the Vata Dosha Nanamcha Vyadhi. Already we have repeated. This is one of the repeated questions. Since you can see question are repeating, so you can you must have to watch all this MCQ. Maybe they can repeat. Diva Sopna is indicated in Ajirna. So Diva Sopna is indicated in these diseases also, like Trishna, Atisaram, Shulam, Swasam, Hikkam, Krodham, Shokam, Bhyam, Klanta. But it is contraindicated in Dushi Visha, Kasa, Srotorodhas, Arochak, Halimakam, Peenasam, Kotham, Pidaka, Kandu, Tandra and Indriyanam Asamartham. So here you can see Swasa and Hikka it is indicated, but Kasa it is not indicated. So like this kind of small things can become if they want to make a difficult paper. So this kind of things they can ask easily. Rakta Vishetam Vata Dosha will have, so Rakta Visheted Vata Dosha will have Aruna Varna, and this we can give simply action by our Yukti, because generally this Vata Dosha will give Aruna or Krishna like color. Pitta is basically Pitta Asita, and Kapha is Ishita Pandu. This is the 3 different color is given when your Rakta is Visheted by individual doshas. Number of Asva Yoni are 9. 8 is Dhanyam Phalam Moolam, Saram, Pushpam, Kandam, Patram, Tavacha, and this Sarkra have only single thing, that is Sura. So total basically 9 Asva Yonis are there. Now you have to comment me like total number of this Asva Kalpana. Then which of the following is not included in Dasha Pranayatna? So that is I have given a reference also. In Sutra Sthana he has mentioned Sankha Devo, Marmatram, Kantham, Raktam, Shukra Ojasam and Gudam as a 10 Pranayatna. Out of this Majja is not included. Right answer will be the option A. Vikalpam Samprapti is the, so Vikalpam Samprapti is Amsham Vikalpam of Doshanam. Question is which of the following gulma is asadhya? So Tridoshaja gulma, that is also known as Nishcha gulma, is asadhyam. Right answer is option C. Dosha predominance in Pundrika. Again see this question is repeated. The right answer is Pitta and Kapha. Nidana Arthakara Roga of Kasa. So basically I have drawn one flow chart here. Pratishya can lead to Kasa, Kasa can lead to Shaya, and Shaya can lead to Shosha. And this disease are known as Nidana Arthakara Roga because they are they are causing cause for the another disease. So Nidana Arthakara Roga of Kasa will be the Pratishya because excessive Pratishya is leading to Kasa. So right answer will be the option C. Selakshana is the quality of, actually, so this is one of the very basic question, but it can confuse us in our examination because we think like this Parthiva Dravya we know, we can know this properties there, but try to understand this basic concept are sometimes confusing in the examination hall. So this kind of things you just give some more pay attention. And Selakshana is a quality of basically the Nabhasa Dravya is particularly mentioned. Okay, then next question is Vasti and Vangshanam are the Moolasthana of Mutravaha Srotas. Then come the Krimi. Actually this Krimi is MK topic given in our syllabus, and there are basically mainly 3 type of Krimi I have explained here in the Abhantra, that is Sleshmala or Purishja or Raktaja. So Sleshmaya is 7 type of krimis are there, and their name is Antrada, Riddhajra, Churavav, Drabha Pushpam, Sogandhi, Mahagudam and Udarta. And there are 6 type of Shonita Karmi naming as Keshada, Lomada, Lomam Dvipam, Sorasam, Udumbaram, Jantu Mantram. 5 type of Purisha, Kakerukam, Makerukam, Leliha, Sashulaka, So Sudarashcheti. So out of this, which one is not a Shonita Krimi is Antrada because it is one of the Shleshma. Next question is which of the following is the division of Parishad? So Parishad is actually the Sabha, and in our 8th chapter of Vimanasthana it is mentioned Parishad is of 2 type, Jnanavati and Moda Parishad, and that is further divided into 3 basic classifications: Suharit Parishadam, Udasinam and Pratinivishtam. Right answer will be the option D. Characteristic of both male and female are seen in Dvireta. According to Lok Purusha Samya Siddhanta, which of the following is corresponding to disease? Kali Yuga is causing the disease. Dwapara Yuga is symbolized with the Middle Ages, Treta Yuga with the Yovan, and Krita Yuga with the Balyavastha. Then Pramanu Bhedam of Shariram is explained in. So Pramanu Bhedam is explained in Sarira Sankhya Sariram. Actually in that chapter, Acharya mentions some important Sankhya also. Like he's mentioning what is the Anjali Parmana of Pitta, Vrakta, Vata. Vata is not mentioned. Rakta, Rasa, these all are mentioned. Vasamajja. Which of the following is the Prakrit Varna? Shama Krishna Avdata is the Prakrit Varna. In previous set we have seen which is the not Prakrit Varna. Here they are asking which is the Prakrit Varna. So this type of confusing question can ask. So this type of thing you have to surely see given in our book. Ashta Maharoga are described in Yasya Asvinimityam Indriyam Adhyayam. And the next question is, out of this which is not a type of Viruddha, so out of 18 type of Viruddha, Samkhya Viruddha is not explained. Right answer will be the C option. Yukti Para Samkhya and per Samyoga is 10 Paradi Guna. So right answer will be the option B. Dash is the type of Hridroga. Total 5 type of Hridroga are there. Vata, Pitta, Kapha, Sannipata, and along with Krimija. So right answer will be the D option. Sashabi, Allergy, Vinatan, Jalani are a type of Prameha Pedika. Sapta Prameha Pedika are there. Dash are the permutation and combination of dosha. So there are 62 permutation and combination. Right answer will be the option C. 20 Nanatmaja Vyadhis of Prameha. Dash is the Utkrishta Sthana for Bala Vardhana. तो यहाँ से ना like this question can come. Ahimsa is the right answer for this question. Viryam is Balavradhana. Vidya is Brahmanana. Indriyo is Nandana. Tatum Avbodho is Harshnana. As per Indriya Sthana of Charaka Smita, Dash is not a type of Prakriti. Lakshya Nimitta is not a type of Prakriti, it's a type of Vikriti. The type of Unmada are 5 type of Unmada are there. So right answer will be the option C. Sandra Meha, Ala Meha, and Tikta Meha are the type of Sandra Meha. Now this is basically your Kafaja. So right answer will be the option C. Samsargat, Lohitat, Pardushnat, Lohitam, Gandham, Anuvidhanatvat are the reason. That's why Pitta is known as a Rakta Pitta. That is a type of Kushta is due to the Pitta and Kapha is Pondrikam. In the Dashavidam Atura Pariksha, so all this will be included. According to Balabheda, the type of Agnis is Sama, Vishma, Tikshna and Mridua. Where is Sama is basically Tridosha combination, Vishma is Vata predominant, Tikshna is Pitta predominant, Mridu is Kapha predominant. Dash is Tu, Khalu, Yat Savam, Indriya Manasam Chaupadam is basically for Prataksha. You can decode it by because Indriya word is there, and when we are using our Indriya for any Pramana, that is Prataksha. In Rasa Vimana Adhyaya, the Prabhava is of Rasa, Dravya and Roga is explained. The description of Chaya and Pratijya is explained in basically Pura Rupyam Adhyayam. This Panna Rupyam Adhyayam. Moksha is Nivritti Margam as well as Apavarga. Kala Yogam Sabhav Samsiddhi Avighatam Ahar Shoshtam is basically Srira Vriddhikara Bhava, whereas Kala Yoga Sabhav Siddhi or Avighat are mentioned. Mana Karma is Anutvam Ekatvam and Indriya Vikram. And the next question is, which one of the following is not included under Jangama Sneha Yoni? So right answer will be the Navnita. In Shloka it is not given as a Navnita. Dadi, Shira, Mamsa is all given. During Vamna Karma, the symptom Loma Harsha indicates. So this is actually from the Sutra Sthana 15th chapter 17th shloka. It is an important shloka. You can read the content of this shloka. Loma Harsha stages, doshas start melting from their own position. Will be the Shiparam Utthanam Prasamam is a feature of, it means it easily manifested and easily it will subside is a feature of both Vatika and Patika type of Shota. So right answer would be the option D. Line of treatment to be adopted in Stholyam is, actually in Stholya we can't give directly Laghu or very unnourishing diet, so we have to give him Guru, but that should be Aptarpanam, and the right answer will be the option D. Unmada comes under one of the Aptarpanam Janya Vyadhi. Next, Hita Atma among Kanda is, so best of Kanda is basically Shangi Vera or ginger. Which among the following is not a synonym of Rupa? Jati, because that is a synonym of Samprapti. Dosha predominance of Udumbra Kushta is Pitta. Buddhi Vibramsha is seen in Unmada. Vishmam Pachyate is the dosha of the food intake related to Ati Vilambita. Because in Ati Vilambita, when you take slowly food, then your food will be going cold and it will take more time to digestion. Agni is inferred from Jarana Shakti and it is one of the Anumana example. Sarva Apachara Sahai Stikshnagli because it can digest all kind of things. Karanam Punam is Bheshjam. One remembering the fruit while seeing the flower is a Smriti Hetu kind of Nimitta because like of effect and cause. In the second month of gestation, if the embryo take the shape of the Arbuta, then child will be Napunsak. If it take Ghana, then it will be Purusha. And if it takes shape of Peshi, then it will be Stri. Anjali Paramana Prakta is a 8. Pura Rupani Atham Swapnam Ya Iman Veti Darunam is mentioned actually in Pura Rupiam Indriyam. Right answer will be the option D. According to Charka, which among the following is not an Ashmari Roga is Ashmari. Next, Pandutva is seen in which of the following? It is a Ati Snigdha Lakshana. Dosha Vikalpa is of 62 type and Tripti is a Nana Atmaja Vikara of Kapha. Bhuta Datri is referred to the Nidra Ratri Swabhavapra. Slow clotting is this characteristic when Rakta is vitiated by the Pitta dosha. Pitta Atma Angpala is Mridvika. Then which of the following guna of Pitta is the prime factor in Samprapti of Pittaja Javra is basically Dravya because here Agni increase in Dravya nature and lead to Ama manifestation causing the Javra. Prognosis of Sannipatikam Gulma is Asadhyam. Dosha predominance of Udumbra Kushta is Pitta. So these are the repeated questions because they are very important. You can see we have already discussed this question. Then memorizing an obese person while seeing a lean is basically the Vipriya because we are remembering the opposite one. Garbhani become Kalanta during the 7th month. Layer of skin is 6 according to Charka and it is 7 according to Shushruta. Hatha Prabha is a feature of Vayu. Pinda Sveda among the following is a Shankara and it is one of the Agni Sveda. Number of Vyadhi according to Dosha Mana Vikalpa is 62. Then treatment principle of Stula Rogi is Guru and Aptarna. We have already seen this question. Srotas involved in Sannyasa is all the Srotas are involved. Bhautik composition of Kashaya Rasa is Prithvi and Vayu. Which Rakta Pitta is Sadhyam because Urdhva Gatam because here we are giving Virechna and many Oshada are there. Number of Bhataki Parmeha is 4 number. Kushta having color of Gunja is a Kankadam that is Tridoshijam. Bhakti Sheelam Cheshtam Achar Vibram is seen in the Unmada diseases. Which will cause Sarva Dosha Prakopanam is Atimatram. How Agni of the patient examined by the Anumana. We have already seen that examine that Agni is a Jarana Shaktiyam. Next question is the Triti Smriti Vibramsham is called as Prajna Pradna. Measurement of Shukra in the body is a half Anjali. Which among the following is an abnormal complexion? Shukla because Krishna, Shama and Shama Udata are the Prakrita Varna. Attribute of dream is prescribed in which chapter? Basically it is explained in the Pura Rupiam Indriya. So here we are going to end our video. Thank you guys.